Welcome to this month's Nest Builders Parent Education event. I am Brittany Badana, Senior Vice President of Marketing and Communications here at the Nest Schools, and today we are talking with our good friends at Zest Pediatric, the Nest Schools' official medical education partner. And we are going to be discussing today a very important topic at this time of year, coughs and colds. Joining me today is Dr. Hellstern from Zest Pediatrics location in Pittsburgh, and Sarah Beer, the Nest School's Director of Core Values, a former teacher and mother of a 1-year-old. Together, we'll be diving into some of the myths and truths between coughs and colds. But before we get started, Dr. Hellstern, please tell us a little bit about yourself and Zest Pediatric Network.
Hi, everyone. My name is Dr. Hayley Hellstern. I am a general pediatrician in the Pittsburgh area, and I am new to the Zest network. I recently opened my office in the Fox Chapel area of Pittsburgh, and I'm super thrilled to be part of a larger network of pediatricians providing direct primary care, which you might be familiar with, but in case you're not, we shorten it to DPC. Some people call it concierge medicine, but basically, we don't use insurance except for vaccines, and we have a monthly membership. And with that membership, you get 24/7 access to us as your pediatrician. So it's your same pediatrician every single time. You can text us, call us, email us at any hour of any day, and we are here for you to answer those questions because we know that a lot of times those questions don't come up while you're in the office with us. And so we like to make ourselves available as needed. A lot of us also offer some in-home visits, and there are a lot of other awesome perks associated with being in the Zest network.
Wonderful. Well, we are so excited to have you here with us today as we get talking on a very popular topic at this time of year, especially as we wind down from the holiday season. We're going to talk about coughs and colds today. And especially with people being indoors a lot over the winter months, we know that this is a hot topic. And there's so much information out there that you can research online about coughs and colds. And there are a lot of myths and a lot of truths behind coughs and colds in general. So we just want to kind of kick off today's conversation with starting with the very basic question. How do colds actually spread?
That is a great question. So coughs and colds are typically caused by viruses, and a lot of times we don't even know the name of that specific virus. There are so many of them, but these sorts of things spread via droplets. So what that means is when somebody coughs or sneezes, these tiny little like water particles of sorts come out and either are in the air that other people are breathing in, or they land on something that then somebody touches and brings to their mouth. So a classic example is a kid will cough into their hand and then touch a doorknob, and then the next person behind them touches that doorknob and then maybe scratches their face or touches their nose or their mouth, and then now they have been exposed to that virus.
And is there a certain amount of time that you need to worry about, say that a child does sneeze and it lands on a surface level, how long viruses can actually live on surfaces for?
Yeah, so they can actually stay on surfaces for really up to the first 24 hours is when I think of you have to be careful if somebody else would then go and touch that surface. So that's where it can be really helpful to have some Clorox wipes or other disinfectant wipes or things to spray down your surfaces, wash your surfaces frequently, because we know that especially at home, we are in and out of doors all the time, touching surfaces, countertops, etc.
Exactly. Well, that is good to know. And I always have Lysol or the little sanitizing wipes with me as well. Hand sanitizer, they are my best friend as we head into these winter months for sure. Well, Sarah, I will let you ask the next question that we have.
Yeah, so I know that we are washing our countertops and door handles and everything like that. Is there anything else that we can do to prevent the spread of the illness?
So there are a couple of things. One, we kind of touched on a little bit, but encouraging kids to wash their hands frequently, and really encouraging all of us as adults, but our children often need a little bit more gentle reminding, I find. Washing hands before mealtime can be especially helpful. So before they take their hands, touch their food, and then bring it to their mouths. Also encouraging them to not pick their noses, definitely not to eat their boogies, and trying to avoid biting their fingernails or sucking on their fingers. So I often find that having a little toy in their hands, like a little fidget toy, can help busy their hands so that they're not in their faces as much. Other things that we can do are make sure that we are vaccinated against the things that we can vaccinate against. So flu is a great example. Flu levels in Pittsburgh are still pretty low, but they are starting to creep up. And so the flu season is beginning, and it is absolutely not too late to get your flu or COVID vaccines for this season. RSV is another one that classically causes what we call bronchiolitis, which is a respiratory illness that can be especially challenging for the babies and can cause a lot of hospitalizations and other problems. So actually, this year is the first year that the RSV vaccine called Beyfortus has been widely available. So as pediatricians, we're really excited about that too.
It's a great thing that you bring up washing your hands as part of meaningful meals at the Nest schools. We do require that our children wash their hands before and after their meals.
That'll be really helpful in preventing the spread of germs for sure.
Yeah.
Yes. All right. Is there anything else? I know we covered hand washing, making sure that you have your hand sanitizer with you when you're out and about, vaccines. What about, are there any other sort of foods that you recommend kind of boosting at this time of year? Like, do they play into any of this at all, of kind of just staying healthy in general, to prevent the onset of, I guess it would be more boosting kind of your overall immunity system?
That's a really cool question. There really aren't any specific foods that I would recommend as a physician. In general, we know that consuming a wide variety of foods, including the fruits and the vegetables and the protein, all help our bodies and our immune systems to stay strong. So I think the biggest thing is to make sure that we are all continuing to have a well balanced diet. If not, then that's where those nutritional deficiencies can come in. And that's when I might recommend something like a multivitamin.
Okay, wonderful. That is good to know. All right. So, when we end up in this time when we do have a sick kiddo at home, what are some of the things that we as parents should be looking out for?
Great question. So there are two big things that I really focus on when a parent is calling me with a sick kid or is bringing their kiddo into the office. They are hydration and breathing. So we know that when kids are sick, even when we are sick, our appetites can be a little bit decreased. And for the most part, that is okay. I just want to make sure that everybody is drinking enough to stay hydrated. So we should be aiming for at least like 3 pees per day. So a baby's 3 wet diapers, or 3 times that our child has peed per day. That comes to about 1 urination every 8 hours or so. So if your kid is doing that, we're in good shape from a hydration standpoint. If they're not, that's a reason to touch base with your pediatrician or seek care. The
Okay.
other thing is breathing. So especially as we're getting these colds and the respiratory viruses like RSV and croup, we want to look for signs that our children are having trouble breathing or increased work of breathing, where they're using muscles other than just their diaphragms to breathe. So some of the signs that you might see at home are really rapid respiratory rate. So the kids are breathing really fast. Sometimes you'll notice their bellies puffing in and out. That's called belly breathing. Or you'll notice that you can see the lines of their ribs when they're breathing. That's called like retractions, sternal retractions. Or sorry, intercostal retractions. Sometimes you'll see suprasternal tugging, where you see this notch here above the sternum sucking in. And sometimes you'll even see their nostrils flaring out or their heads bobbing up and down with each breath, like
Really knowing that they're struggling.
Yeah.
so if you're seeing those signs, that's another reason to touch base with your pediatrician or seek care. One thing to keep in mind, and I've seen this in my own kids, is sometimes as kids' fevers are starting to spike, sometimes they will start breathing faster and looking like they're having a hard time. So check your kid's temperature, maybe give a little Tylenol or Motrin, and see how they're doing. But definitely be on the lookout for hydration status and respiratory.
Okay. Well, I know that is always very scary as a parent, especially as a first time parent,
Yeah,
like knowing, are they okay? Do I need to make that phone call? So that is very, very good advice for us to be on the lookout for. What
absolutely.
about, I know, we're going to talk a little bit about coughs, but as far as the sound of a cough,
Yeah.
at what point should you be concerned about how a cough sounds or how long it is going on for that you should seek medical care?
So I guess that's kind of a two-part question. So in terms of how the cough sound can sometimes tell us a lot about what's going on, but there isn't a real specific sound that I could describe to you that I think parents would feel comfortable assessing and hearing and then deciding whether or not to take their kids in. So I would say, cough aside, if with the cough your child is having difficulty breathing, like what we just talked about earlier, I would absolutely have them seen. There is the classic seal-like kind of barky cough, that hollow cough that's associated with croup. It's often worse at night. You get these bouts of coughing, and a lot of times, opening the door into the cool night air or opening a refrigerator door can be really helpful in cooling down the airways and kind of calming them down and suppressing that cough. Um, there's also that bronchospastic asthmatic cough, but usually with that, the child will be showing you other signs that they are having trouble breathing. Wet
Okay.
cough, dry cough doesn't really make a difference to me. What makes more of a difference is how comfortably they're breathing and what other symptoms they're having. Are they still able to stay hydrated even though they're coughing so much? Are they overall comfortable? Has this been going on for just a day or two? Or has this been going on for weeks and weeks? In
Okay.
terms of duration, I think, with most coughs and colds, kids will get a cough for about a week, but sometimes that cough can linger for like up to a month. But little by little, it should be getting better. If it's not, then after a couple of weeks, I would definitely want a child seen. So 2 weeks or more just kind of raises my suspicion for things like walking pneumonia, which is caused by mycoplasma, which has been going around a lot this season. Also raises my suspicion for other pneumonias, though with those I typically would hear about a little bit of chest pain or some fever or some other symptoms. And it also raises my spidey senses a little bit for pertussis, which is also known as whooping cough, which is a vaccine preventable illness that in Pittsburgh we actually saw a bit of a spike about a month or two ago in. So 2 weeks or more of a cough, I would probably have your kiddo seen, unless you've already talked to your doctor about it and your kiddo is otherwise doing okay.
Great, great. That's all very good advice because they come in all different sounds and I think they vary. I know in my family it varies kid to kid on the type of cough that they always get. So that is great
And
advice.
it always goes away right when you get into the doctor's office. Just
I
like
know, I know.
and they're there, they're running around, and you're like, I swear they were sick last night. And we know, right? We as pediatricians, we know that.
Right. Yeah.
Sometimes it can be really helpful if you take a video of the cough that they've had in the middle of the night, so that when you do come to the office and they are seeming better, the doctor can at least kind of hear what you were hearing. I found that
Right.
to be really helpful.
I know Sarah, you have done that before. You've talked about doing that before as well.
Yep. Oh, excuse me. Yeah, I have done that. Of course, I would lose my voice.
Well, we're talking about coughing.
Of course, right? Yes, I have done that. I thought that she had whooping cough based off of her cough, so I did record it and bring it to the doctor, but thank God it was not.
Thank goodness, yes, absolutely.
Speaking of coughs, is there ever a time that you would recommend cough medicine?
Great question. I get that all the time. I think that answer is really going to depend on the age of the child. Cough medicines really aren't super effective in anybody under 12 years old. So I usually save my recommendation for cough medicine for the preteens and teens. Between the ages of 5 and 12, they can be safe and okay to give, but they often don't do a whole lot. So, what I usually recommend more is having a humidifier in the room, elevating the head of bed as long as they're toddler aged or over, and we don't have to be worried as much about safe sleep at that point. Honey is another great natural cough suppressant. It has a lot of good antimicrobial properties. So as you're swallowing it or eating it, it'll kill a lot of the gunk back in your throat. And it also works really well to keep that cough at bay. We just have to keep in mind that children under the age of 1 can't have honey. So for those little babies, unfortunately, there's not a whole lot to do. Although a lot of times, if you've probably found this in yourself, a lot of times that cough is coming from that post-nasal drip. So all of that nasal congestion is then leading to the cough. So what we can do is grab, actually, I have one right here, a bulb suctioner, and suck those boogies out of our baby's noses before feeds and before bed. And that can be really helpful too.
Great. I was just going to ask that is if you had any recommendations. I know it's so tough when they're itty bitty, trying to help them. And so that is great advice. I think just reminding us to make sure we use those tools that are available to us. And I know in my household, we are big fans of the humidifier with colds. Those really, really do seem to help my kids at least. So.
Yeah. We have trouble with our kids getting them to blow their noses. And
Yes.
for better or worse, we've instituted a rule where if you don't blow your own nose, mom or dad are going to have to help you blow your nose, whether it's with the tissue or with this. And so my kids know that the bulb suctioner is coming out if they don't blow their noses, because I don't want them to get sinus infections or pneumonia or these other things. And I know that it's important for them to get that stuff out.
Right. What about I think the saline spray that you can use? What do you recommend that? Is that helpful?
Absolutely. Yeah, that can
Okay.
be really helpful. And you don't even necessarily have to use the bulb with it. You can just use saline nasal spray or nasal drops. That's really helpful in kind of making all of those the thick mucus in the nose looser, so it drains a lot easier. So with a lot of babies, I will use it before using the bulb suction. But with older kids, sometimes just doing the saline nasal spray can be really helpful in getting that congestion out.
Good. Very good.
Saline has been a godsend in our household.
What a little salt water can do, right?
Yep.
We don't have to go
Yes,
super fancy all the time.
I know. I know. Well, good. That is awesome.
Since you have one of those bulbs with you, would you like to show us how it's used properly?
Absolutely. I happen to have one of my daughter's baby dolls in this room with me, so this will be perfect. So obviously we're going to have our baby in front of us on a flat surface, and we might have used, one of those nasal saline drops like we talked about, 1 or 2 drops in each nostril, and you can let it sit for a little bit. So what I typically recommend doing is, let me see if I can make this work, is baby's lying down, and if I'm going to be sucking out her right nostril, I'm going to take my finger or thumb and block the left side, okay? And then what I'm going to do is I'm not going to squeeze it like this. I'm actually going to put my thumb on the top part and squeeze it out, press it out that way. And all of the air is going to be out first because we don't want to puff air into baby's nose. That's uncomfortable. So then we put our bulb in and suck, or sometimes I can even use my finger and thumb to kind of keep it in place and suck, and then do it on the other side and suck. So we're always pushing in the top part. And that's the issue that I find most parents have, is they haven't learned how to properly get all of the air out of the bulb. And then when they're sucking out of the baby's nose, it's just not super effective.
Thank you.
Just don't get a good suction. I think I just learned that I was guilty of squeezing it the wrong direction. So thank you so much
Welcome.
for demonstrating that for us. I think that many parents will learn a better way to do that now.
It's great to have an easy-ish cheap tool at home that you can use. So I fully understand that wrangling a sick baby or toddler in order to stick a bulb suction up their nose is not necessarily everybody's definition of easy.
Right, right. Well, absolutely. Thank you so much for showing us that. And I know we've covered a lot of really great information about coughs and colds, just general information that can be helpful for this time of year. But we always like to ask some of our Nest Builders community for questions that they would like us to ask you. And I do have a couple questions. So the first one is around the different homeopathic remedies that you see that are available. The question is, do they really work, and is it something that you would recommend?
So I think that's going to be a tricky question because as a an osteopathic medical physician. That's not something, the homeopathic remedies aren't necessarily something that we are trained on or study in our pharmacology courses. By definition, they have tiny, tiny, tiny little amounts of whatever's in them. Some families find that they are helpful. I personally haven't tried them on my children. I think a lot of them on the market aren't necessarily dangerous. So again, as long as they don't have things, I know like Zarbee's, for example, has honey in it. So you don't want to give those certain honey containing products to kids under 1. I don't think it can hurt. I just can't necessarily recommend it in the sense that I can guarantee that it's going to make a difference.
Great. No, that is wonderful advice. I always wonder, there are different ones that come out every year. I had my sister send me a new throat spray one the other day, and but I have always wondered, and I think a lot of people wonder, what works, what doesn't, and they can be quite expensive too. So,
Sure. And again, I mean, medicine is ever evolving. We're always discovering new things. So I don't necessarily feel comfortable saying, no, they absolutely don't work. So if you find something that works for you and that is safe for your child, please have at it. I just don't know enough about it personally to give a medical recommendation to take them.
right, absolutely.
And with this being the time of year that everybody is just getting sick, is there anything unique to a cold that differs from anything else, like the flu or COVID, or like what is that differentiating factor?
At this point in time, it's really going to be hard to tell, right? I think when COVID was first a thing, it was often hitting a little harder than a typical cold would. People were having more fevers, a lot more respiratory trouble, anosmia where they couldn't smell. Now the cold, the flu, COVID, they all kind of seem the same. So I really do, recommend that if you have any cold symptoms, you take a COVID test just so that you know if you should maybe hunker down a little bit more to prevent the spread of COVID. The guidelines now from the CDC actually group flu, COVID, all sorts of colds all together in terms of when you can kind of go back out into the wild, if you will. And basically the gist of it is you want to have your symptoms improving for the last 24 hours, and you want to be fever free for a full 24 hours without a fever reducer. And if you meet those criteria, then your risk of spreading the virus, whatever it may be, is going to be lower.
Great. That it is so hard, and they're all so similar to one another that yeah, it is kind of a one of those, we kind of wait and give it a little bit of time, but if I suspect that it's COVID, that's kind of what we started to do with our family as well too, because we have some elderly grandparents that were around and things of that we try to be extra careful about.
What I will say is with the flu specifically, and this changes a little bit year to year, but if you have a kiddo who's like fine and then over like 6 to 12 hours, they are very not fine and they've got a really high fever, there's a good chance in my mind that it could be the flu. I've seen flu a lot, especially flu A recently, where it's just like all of a sudden you get hit with it. You're sick, or sorry, you're not sick, and then you're sick, and you can almost pinpoint the time when you got sick. That screams flu a little bit more to me. And if you are a high risk person or have somebody who's high risk at home, you can talk to your pediatrician or doctor about Tamiflu, which is that antiviral that you can take. Sometimes it has some side effects of headache and nausea and things like that. So it's not for everybody, but it can be helpful in shortening the course of illness a little bit and in hopefully preventing the spread amongst family members and such.
We just recently went through this with my daughter. Is there a point where Tamiflu would not be okay?
Excellent question. So for Tamiflu to be effective, you really need to start taking it within the first 48 hours of symptoms. So if you miss that 48-hour window, it's probably not going to help a whole lot.
Yes, timing is key, sounds like. We've talked about duration. We've talked about some of the different, things to be on the lookout for. What about antibiotics? How does a parent know when they might need to be seen for antibiotics, or when are they helpful in treating some of the different illnesses that we're talking about or side effects of colds?
So a lot of what we've talked about are colds, flu, COVID, RSV. These are all viral infections. So by definition, if you think about antibiotic, it's really fighting a bacteria. So antibiotics are not going to be helpful for just run-of-the-mill colds, flu, COVID, RSV, that sort of thing. Now, what can sometimes happen is a kiddo or adult will get a cold, and then because of all of that congestion and everything, a bacteria can kind of come in and fester and then develop some sort of bacterial infection. I kind of describe it like a bird bath or a puddle in the summer. Like you get a bunch of water collecting and then mosquitoes find it and lay their eggs, and then you get a whole other problem, right? So, for example, if you get a viral infection, you get a bunch of gunk stuck in your sinuses, and the bacteria come and find it, and then bam, you've got a sinus infection. Or ears are a similar picture, right? A kiddo gets a cold, a week or two later, they might develop ear pain. So there's a sign to look out for. Or they might all of a sudden spike a fever. That's when I would recommend having them seen to see if bacteria has kind of found its way in. So a lot of times, a week or two of symptoms, 10 to 14 days, bring your kiddo in to make sure we don't have a sinus infection or an ear infection or pneumonia. Those are probably the three big ones.
Great. That's wonderful information. Appreciate you covering that with us as well. I always cross my fingers that, when they start feeling better, it doesn't creep back up again, because that's what I always start worrying about.
Yeah. I guess the other thing to think about too is strep throat, and that's something we haven't talked about. That is caused by a virus alone. Classically, it's just a sore throat and a fever. Sometimes kids can get belly aches or headaches with it. Sometimes they'll get a red rash on their chest or something. And that is something where an antibiotic will be helpful. And you typically do need to have your child tested for strep throat before bringing them in, because as we all know, there are plenty of times where a kiddo will have congestion and postnasal drip, and that will cause the sore throat, but an antibiotic wouldn't help in that case.
Okay, great. So normally with strep, antibiotic is recommended.
It is at this time. The antibiotic, it's hard to tell if it really makes you feel that much better that quickly. I find that often it does seem to, but really what we're trying to do with that is prevent long-term effects of strep throat on the heart and other parts of the body.
Well, we've been exposed and we're sick, so we either take our medicine or we don't take medicine, but we are feeling better. At what point can we come back to school?
Yes, that is a great question that I hear a lot. So one thing that you mentioned is we're feeling better. So we don't want to send our kids to school if they're just going to be feeling miserable, huddled up in a corner, not participating. That's no fun for anybody, right? Assuming they are feeling better, we need to make sure that they have been fever-free for 24 hours on their own. So that means fever-free without any fever-reducing medication like Tylenol or Motrin. We also need to make sure that they haven't had any episodes of throwing up or diarrhea in the last 24 hours. And if you're ever in doubt, I always recommend touching base with your medical provider.
So obviously when you have a sick kid at home, that can seem to affect the whole family. You have to take off work and all the things that are related with that. Is there any benefit that you have found in the timing of when you put your child in a school setting?
So that's a great question that a lot of families have asked me about too. I think no matter what, kids are going to be exposed to these viruses and illnesses. So the first thing to keep in mind is what your family's needs are, if you can keep them home, or if you need to send your kid and have them watch during the day while you're working, or other commitments like that. At some point, like I said, the kids will be exposed to these viruses and illnesses. So within the first year or two of them going to any sort of childcare, daycare, preschool, they are going to get sick a lot. I mean, kids get like 8 to 12 viruses per year, it seems. So that's like almost one every month. That is a lot of sicknesses. And if a kiddo isn't starting school until they're 4 or 5, even 6 years old, well, then when they get sick with those illnesses and they are staying home because they have fevers or are throwing up, they might be missing some of those pivotal points in education where they're learning the fundamentals of reading and writing, which can be detrimental to their learning. So I actually recommend getting them exposed to these viruses earlier, building up their immune systems, and letting them miss out earlier on so that they can be fully present as much as possible in those kindergarten, first grade, et cetera, years.
Absolutely. I know that we went through that with my kids both being young, and when they did get to kindergarten, they did not miss much school at all. So there was definitely some benefit in that for us.
Absolutely. And of course, COVID kind of put a wrench in that a little bit. I know like my son did a couple years of preschool. He's in kindergarten now, and we've had our fair share of illnesses, but I'm hopeful that by next year, we won't have as much of that to deal with.
Well, Dr. Hellstern, thank you so much for joining us today and covering this very important topic that all parents have to face. I know I learned a lot of information. I'm sure Sarah did as well.
Yeah.
And if any of you that are tuning in today, if you are interested in learning more about Zest Pediatrics, you can find them online at www.zestpeds.com. And we have lots of other great topics for parents, everywhere from parenting advice to medical advice to wellness advice, all available on our website, thenestschool.com. And just look for Nest Builders, and you can catch lots of great episodes to learn and for you to learn from and help you on your parenting journey. So thank you both for joining us today.
Thank you so much for having me, guys.
Thank you.
Hope everybody stays healthy this season.
Yes, you too.
Absolutely.